Chances are, if you have used the nasal decongestant for your sinuses for more than a maximum of 3 days, you might have even more congestion down the road. So in this video, I'll explain how exactly to treat rebound congestion. Hey guys, it's Yaseen Arsalan again, back here with another video where we continue this series of health and wellness topics this channel explores. And today, I've brought up a topic that I was personally going through at one time as well, and that is rebound congestion. Ever since I tried Afrin for the first time, I immediately knew this was like a wonder drug, as it worked so fast in cleaning up all my sinuses. Before ever going down my pharmacy career, learning about so many different types of drugs and conditions, I never knew how harmful it might be to take the spray consecutively more than 3 days. So today, let's talk about what rebound congestion is and some of the ways to alleviate the problem that comes with it. Also, don't forget to stick all the way to the end for a bonus tip that might help you even more. Rebound congestion, otherwise known as Rhinitis Medicamentosa, is a condition where your nasal passages are inflamed. This causes congestion usually without any running of the nose. It is caused by nasal decongestant medications and happens about 5 to 7 days after taking a decongestant like oxymetazoline or Afrin. People will start to continue using them more and more, thinking that it would help their congestion, but they're actually making matters worse after about 3 days. The swelling of the nose actually leads to what is known as turbinate hypertrophy, which basically causes the structure of the nose to change. So how decongestants work is basically constricting the blood vessels in your nose, causing them to shrink in size in order to minimize the inflammation. They are simply used because your nasal passages get swollen when you are congested. So by minimizing their size, you reduce the swelling. So now that we defined both rebound congestion, otherwise known as Rhinitis Medicamentosa, and how decongestants work, let's move on to ways to treat rebound congestion. The treatment basically involves stopping the medication altogether in 2 ways, either through a cold turkey method or weaning off. The cold turkey method is obviously more effective as it directly removes the causing agent. But the time between when you stop and get relief from the symptoms might take too long and is too uncomfortable for patients, especially when they're ready to fall asleep. That's when weaning might be more beneficial, as you still can get airflow into your passageways. The medication Rhinostat has a gradual withdrawal and titration system designed to help with this exact process. Ask your doctor if Rhinostat is a good solution for your rebound congestion. Studies do show that even if you have been misusing decongestants even for years, it could still be treated successfully. The recovery can take up to a week and withdrawal symptoms are relatively easy to manage. And now for the bonus tip. The over-the-counter saline nasal spray may help open the nose without causing any rebound, as long as the spray does not have any decongestants. You can also try steroid nasal sprays, as some studies show that this might be the best way to stop overusing decongestants. So, just to highlight an important point, here's the right way to take nasal decongestants. Number 1, use a decongestant as directed. Follow the instructions on the box or your doctor's instructions. Don't use it longer than 3 days, and use it once every 10 to 12 hours, and making sure not to use it more than twice in 24 hours. Also remember, what works for one person may not work for another, so talk to your doctor if you feel like you need further help with dealing with the rebound. Thanks for watching. Hey guys, as you can see, I'm out here for my morning walk. And I wanted to give an extra tip that helps me usually when I get all stuffed up, and sometimes it's best to just go out and exercise. For me personally, it has helped with like clearing my sinuses, because for some odd reason that whenever I get sweaty or have a good workout, I'm able to breathe better. So this is the Afrin that I use. It's the generic brand, but I'm not using it because I've used it for 3 days and I don't want to get more rebound congestion. So I just go out and enjoy this walk, and it actually helps me. So, question of the day. Have you ever had rebound congestion or have a nasal spray addiction? Do you know of any extra tips and tricks that have helped you that I haven't mentioned in this video? If so, let me know in the comment section below. Thank you so much for sticking all the way to the end of this video. Make sure you hit that subscribe, like, and notification icons for more videos like these. Until then, see you on the next one.